The peroration is the end and conclusion of a speech, consisting of 3 parts: the summing up, the indignatio, or the exciting of indignation or ill will against the opponent, and the conquestio, or the arousing of pity and sympathy. Cicero encourages investigation of the indignatio in 15 topics, many of which apply to the case I chose to explore. The following case is taken from the movie One Flew Over the Cuckoo's Nest, a film adaptation to a novel of the same name. Nurse Ratched, the head nurse of a ward in a 1960s mental hospital, is arguably directly responsible for the death of a patient on her ward. She is demonstrably responsible for the permanent disability of another. I will attempt to perform a thorough excoriation of Nurse Ratched using Cicero's topics as they relate to the indignatio. As the head nurse of a psychiatric ward, you know much about your patients. You know their medical history, you decide upon and dispense their medications, and you glean information from them in therapy. You shape their reality. In a way, you are a god to a small number of patients that call the ward their home. In 60s-era psychiatric care, sedatives, electroshock therapy, and lobotomy were meted out with the intent to control rather than rehabilitate. In gentle hands, such methods might be tempered with good intention, but there are no gentle hands in the case that follows. The head nurse in this case is Nurse Ratched, a stern, unforgiving woman who tolerates nothing outside of the strictly maintained routine on her ward, which could be argued as simply part of the job. But her arsenal includes humiliation, fear, and intimidation. She enforces her rule with glacial coolness of demeanor informed by a pride that makes it impossible for her to tolerate any form of disruption without seeking retribution. When Nurse Ratched's methods result in the suicide of her youngest patient, a question arises. Despite never laying a finger on the man, is Nurse Ratched a murderer? Cicero's second topic is thoroughly applicable. Those affected by Nurse Ratched's actions are her inferiors. Their care is entrusted to her, and she violates that trust with her actions. The patient in question is Billy Bibbett. Billy is a voluntary patient with a near debilitating stutter who stays in the ward because he is terrified of the outside world. Another patient, McMurphy, is a self-assured, wayward misfit, involuntarily committed and feigning insanity to dodge a sentence on a work farm. He shakes the monotony of the ward with his conduct, infuriating Ratched and dazzling the timid Billy, who longs to evoke a similar confidence. Billy is often the target of Nurse Ratched's most used method of control, public humiliation. Deeply scarred by his abusive and controlling mother, Billy remains completely inexperienced with women at 31 years of age. Billy has never known anything but to constantly strive for and fail to acquire his mother's approval. Billy's mother and Nurse Ratched are, according to Ratched herself, old friends. One would think Nurse Ratched's familiarity with Billy's history and family might make her more understanding of his emotional state, but it only makes her dig deeper. Cicero's sixth topic speaks of actions done intentionally and purposefully. All of Ratched's actions are intentional, and she knows exactly what she's doing. In group therapy, Nurse Ratched zeroes in on Billy's past attempt at suicide. After stuttering out a response to her, a patient in the group begins to laugh. As if contagious, the laughter spreads throughout the group and even to Billy himself, who for the first time seems to recognize his anxieties as comical instead of insurmountable. Rankled, Nurse Ratched quickly subdues Billy by poising his mother's disapproval like a guillotine over his neck. Billy deteriorates, hardly able to speak due to renewed fear. Other patients attempt to shift her focus to relieve Billy to no avail. The therapy session spirals out of control, ending with McMurphy in a fistfight with an attendant. Nurse Ratched primarily sees McMurphy as the root of the discord festering in her ward. Ratched calls for backup and begins to exact her revenge. She uses the disruption to make use of electroshock therapy. Ratched attempts to subdue McMurphy using this therapy, not because she believes he would benefit from it, but because she believes the other patients would benefit from seeing what happens to those who challenge her. She gives the same treatment to the patient who was the first to come to Billy's defense. As Cicero says in the 8th topic of indignatio, Nurse Ratched's crimes are not ordinary and are in fact outlandishly cruel. She thoroughly violates the sacred relationship she is charged with. Her victims are her patients, those who can neither harm another nor defend themselves. In addition, Cicero's 13th topic speaks of insult to injury, the punishment of a man she perceives to be her enemy, despite the fact that he is her patient, indicating the haughtiness and arrogance with which Ratched operates her ward. Afterward, McMurphy returns to the ward with his attitude intact. Knowing now that he has no hope of neutralizing the wrath he has incurred in Ratched, he plots an escape from the ward, but not before throwing a going-away party. McMurphy rounds up 2 women friends from the outside, convincing them to bring liquor and sneak into the ward one night. Billy's especially taken with one of the women, admitting to McMurphy privately that he likes her. McMurphy arranges for the woman, Candy, to spend the night with Billy. In the morning, Nurse Ratched arrives to chaos in her perfect prison world. She searches the rooms and finds Billy with Candy. Exiting the room, Billy is met with applause by his fellow patients. Confronting Nurse Ratched, Billy says he can explain everything. Nurse Ratched asks him,
"Aren't you ashamed?"
For the first time, Billy doesn't hesitate or stutter at all in his response.
No, I'm not.
For a brief flash, Billy Bibbit is no longer an overgrown, frightened 31-year-old boy, but a man. Nurse Ratched eyes him coldly and delivers what proves to be the death blow to Billy.
You know, Billy, what worries me is how your mother's going to take this.
Immediately robbed of his newfound courage, Billy is reduced to a stuttering, pleading mess, literally on his knees, begging Ratched not to tell his mother. Ratched insists that she has no choice. They're old friends. How could she keep this from her? She demands to know who orchestrated the party, and Billy can barely say McMurphy's name. McMurphy watches with horror as Billy is dragged away while screaming and hitting himself in a total loss of control. Billy is left in a room to await the head doctor while attendants try to calm the other patients. Suddenly, a blood-curdling scream echoes through the ward. A nurse has found Billy Bibbit dead, having cut his neck with broken glass. Mere minutes have passed since Ratched's final words to him. Ratched enters the room, checks for a pulse, and exits, informing everyone that the best thing to do now is to continue on with their everyday routine. Enraged, McMurphy launches himself at her and wraps his hands around her throat. Guards pry him off and take him away. She is left bruised and breathless, but alive. The following morning, rumors surround McMurphy's whereabouts, with some saying he's escaped. But later that night, he is brought quietly into the ward and put to bed, and it's shown that he has 2 scars on either side of his head. McMurphy has been lobotomized, robbed of his consciousness by Nurse Ratched just as surely as Billy. Once decided, none of Ratched's actions can be changed by any judicial body. Cicero's 5th topic. In the face of temporary wounds to her pride and control, she responds with permanent solutions that rob at least one, arguably 2 men of their lives. Cicero's 11th topic involves showing that the act was committed by one who least of all should have done it and who would have been expected to prevent it if done by another. It cannot be overemphasized that Nurse Ratched was charged to care for these men. Instead, she tortures them.